That's why my ex is still my ex. I never trust a word she said. I'm running all the background checks and she's freaking out. Every time I turn around, just something don't feel right. I might be paranoid. Okay, so that was lyrics by the Jonas Brothers. Don't hate. It's called I'm Paranoid. And there's actually different levels of paranoia, surprisingly. So, what kind of paranoia are they talking about? Well, I think they kind of cover it, and let me explain why. Hopefully, in the next few minutes, I will be able to cover the differences, well, compare and contrast between the two mental disorders of paranoid personality disorder and paranoid schizophrenia. I will hopefully be doing this by telling you through the definitions of the types of mental disorders that they are, the causes of the disorders, the symptoms that result from the causes, how to diagnose it, and hopefully the treatment of the two mental disorders. So first of all, what are these two mental disorders? Well, mental disorders in and of themselves, according to the American Psychiatric Association, are mental behaviors that they interrupt important aspects of life. So, first of all, we have paranoid personality disorder, which is personality disorder. A personality disorder is, well, they are inflexible behavioral patterns. So, that kind of, like the original says, it interrupts with important aspects of life. And schizophrenia, paranoid schizophrenia is under the category of schizophrenia. There are, I think, 3 different kinds of schizophrenia. Paranoid being probably around one of the most common of the schizophrenias. Schizophrenia is, hold on. Schizophrenia is kind of like the disruption of your perceptions. So it could be auditory or like visual. What causes these? Well, according to Bernstein and others in a book that he wrote in 1995, according to him, there's not really much known for the cause of PPD, for short, which is sad because then it's harder to find treatments, it's harder, so they basically find out what it is based on the symptoms alone. Paranoid schizophrenia, on the other hand, there's a lot of research done on it, so there's a lot of theories, which makes it almost a little harder. There's the theory that you have increased dopamine in your brain. There's also decreased metabolic activity. There is the theory of, it could be like a stressful event caused it, or maybe an event during pregnancy, so it could be environmental. And actually, one of the most common is the fact that it's your brain. Most mental disorders have a problem with the brain, and it's, according to research done by a guy by the name of Thompson, he says that over a 5-year study, a healthy teenage brain loses 1% of gray matter. Gray matter is, well, obviously a gray colored matter that covers the brain and tells the brain how to react. So, like, if there's pain, it'll tell the brain, about the pain, and it sends messages throughout the brain. And when you lose it, it could affect, depending on what part of the brain. So what it does is it mostly affects the frontal and temporal parts of the brain, which is bad because then you lose the ability to remember things, to pay attention, you lose your motor functions, and I already said that, just kidding. So, also with but what Thompson found out was in 5 years, opposed to the normal teens who lose 1% of their gray matter, they actually lose 5% of their gray matter, which means that it becomes actually a lot lighter. The inside of the brain, the cavities fill up with fluids. It's just not really a nice picture to think about. Yay, play. Okay, so we know the cause, well, we think we know the cause, but the cause leads to symptoms, the outward shows of what these are. Symptoms of paranoid personality disorder. These people are really, they kind of get like random outbursts of anger. You don't know why they're angry, but they just randomly get angry. They're really distrustful. They're kind of paranoid that, you know, the people that are closest to them are out to get them for some reason, you know, with no evidence whatsoever. While people with paranoid schizophrenia have what are called positive symptoms. Positive symptoms don't mean they're better symptoms, but they mean that people can't see them outwardly as easily. People either have hallucinations, which means that their views are disrupted, you know, they don't see things the same way as you do, or delusions, which means that they are kind of incriminating you without any evidence. So it's almost like PPD in a way. Okay, and then symptoms, once you find out what the symptoms are, you have to get diagnosed. Well, it's really hard to get diagnosed because you could go to the wrong places. People think they know what they're talking about, but you can actually get misdiagnosed. One of the more, like, if you go to the right people are a psychiatrist or a licensed medical professional. A psychiatrist is really important because if you want to get diagnosed correctly, these people will sit down not only with the patient, but the people who are involved in a patient's life to know what all the aspects are to be comfortable with giving a diagnosis. But if you go to the wrong people, you get diagnosed. According to Arietti, a man who wrote a book in like 1974, he wrote that people can accidentally mistake hallucinations that are drug-induced for those of schizophrenic. So it's really important that you go to the right people, or else there's a great possibility that you can get misdiagnosed. I mean, sometimes even these two could get confused for each other. After that, once they find out what the diagnoses are, what's wrong with you, they could treat you. There are two ways of treatment. There's therapy, which is good because they can actually watch you and make sure that you're like taking any meds if you need meds. They are great for helping you out, understanding what you're going through, just being there personally for you. Where medications are kind of a bad thing because people, when they're on the medication, go, hey, I'm better, I don't need the medication, but really they do. So that's all I could probably say in this amount of time. There's a lot more that I could say, but sadly I can't much. So hopefully you can see through the definition, the causes, the symptoms, the diagnosis, and the treatment that while they are similar diseases, they do have quite a difference between them. Thank you.
All right, Kai, what did you think?
For the weaknesses, I thought she was a little nervous, which is understandable. We're all a little nervous. She's speaking a little fast, and I noticed in the beginning that she's kind of pacing back and forth a little, which is, you know, all of it's understandable. So I think you should work on slowing down a little bit and trying to be a little more casual. As for the strengths, I felt like her attention getter was really strong, and showed a lot of bravery singing from the class. And I thought the thesis was very clear. I knew right away it was about paranoia and two other things. And I thought she gave a lot of good information. She sourced her information well, and I thought it was a really good speech.
All right. Yeah, I like the song. I thought it was kind of a cute way to get started on the topic. See, there's a positive comment. You know? And I did think that it was kind of brave of you to do. Another positive comment. I thought you had a very clear statement of what your goal was for the speech, and an even better preview of what the content was going to be. 4 positive comments to start with. All right. In fact, I thought your transition to the first point was excellent, and you did a good job on the second point as well. More positive comments. I thought there was a little bit of a rush on that third one, though. It's like you realize, I got to get to treatments, and boom, next thing you know, we're in treatments. And so you kind of dive into that, and you lose the flow a little bit. Okay, there's a negative, so we got 5 on one side, 1 on the other side. Going to add a couple on the negative side. The visual aid doesn't really help you very much. It organizes a little bit to remind us about what you're talking about, but it doesn't really explain anything or add any understanding to what we've got. The brain model that you have, your clay, for instance, it's a distraction. You don't really use it for anything. You pick it up and hold it, and then mostly you're kind of handing it back and forth between your hand and it becomes a kind of a crutch for some of those anxiety things. And so if you're not going to make a reference to something specific on it, you could probably do without it, and I think it would be just fine. All right, so there's not as much development of the visuals as there could be. I do understand what Kai's talking about, though, about your rushing. You seem like you are very anxious from the get-go, and it's probably because you have a lot that you're trying to get in, and you may have needed to refocus and say, instead of talking about the treatments or even the causes, let's just talk about what the difference between these two maladies are. You know, what are those differences, and outline those for the audience so we can understand why sometimes they are confused for one another, but in fact they are substantially different. And I think you'd have had enough time then to talk about each of those things. You wouldn't have felt that you had to rush through the presentation, and that would probably be a good choice to make. All right. A negative comment, but I thought I phrased it pretty reasonably. But if you guys see it differently, you'll let me know. All right.